हंसी आ रही है बहुत आवाज सुनकर, but trust me, snoring is not funny. Snoring means the person's body who is snoring is not getting sufficient oxygen. The person is gasping for air. The person is not able to breathe properly. Yes. Hi, good morning everyone. I am Dr.Kanchan and in this video, I am going to tell you how can you solve your snoring problem. How can we as a dentist solve your snoring problem? But before that, I am going to tell you what is snoring and how can snoring prove to be dangerous to your heart, to your brain, to your body as well as to your life. So now let's begin. According to the National Sleep Foundation, almost around 1 billion people they suffer from snoring. And the snoring means the person is not able to sleep deeply and peacefully. आपको अच्छे से नींद नहीं आ रही है और जब ऐसा होता है you feel tired and lethargic the other day. Am I right? Yes. Bappi Lahiri, Mr. Bappi Lahiri, he died of obstructive sleep apnea. What is obstructive sleep apnea? I'm going to tell you. And he is not the only celebrity. Carrie Fisher, do you remember her? Known for her iconic role as a princess in the Star Wars movies, she also passed away after OSA, obstructive sleep apnea, caused her cardiac arrest while she was on a flight. So now the question arises, what is OSA? Obstructive sleep apnea hai kya? OSA means obstruction in your airway that is causing a difficulty in sleeping. देखिए, ये होता क्यों है? When you sleep, your throat, your lower jaw and your tongue, they relax completely. And when they relax, your airway becomes narrow. जो आपका सांस लेने की जो नली है, वो बहुत पतली हो जाती है. So, अगर ऐसा होता है, if your airway diameter decreases, then what is going to happen? Will your lungs be able to get sufficient oxygen? Will the sufficient air be able to pass through that airway? No. होगा क्या? That is going to cause you snoring. That is the reason of snoring. Now, what can happen next? How can the condition become severe? When the obstruction in the airway is complete. Maybe because of a neck fat, because of a facial fat, because of abdominal fat. Yes. When the airway gets completely blocked. So now what is going to happen? The person's body is not getting sufficient oxygen. The person's body is feeling difficulty in breathing. The person is gasping for air. Snoring का मतलब ये होता है. So अब समझ में आया? Snoring is nothing funny. It's not funny. It's a serious health condition. और होगा क्या? When the person's body is not getting oxygen, when the person is sleeping, the body will go into a stress mode. The BP will fluctuate. The heartbeat will fluctuate. The body is not getting oxygen. The person can die. So, the brain will now try that the body does not die. तो क्या करेगा? उस बंदे को उठा देगा. उठो. You have to breathe in air. You are not able to breathe properly while you are sleeping. Yes, please, come on, wake up, otherwise you will die. So this is what happens in snoring. The person might wake up, even 30 to 40 times an hour. I have seen cases like that. और जब ऐसा होगा, you will feel lethargic and tired the other day. Am I right? Yes, you will feel completely lethargic and tired despite sleeping for several hours. That is going to reduce the productivity at your work, right? And studies have shown that snoring people, they cause huge number of road accidents. Snoring is one of the reasons for road accidents. Yes. So we have to treat this condition before this condition kills you. So now I'm going to tell you about the treatment options that are there available that can solve your snoring problem and thereby help you to sleep better, deeply and peacefully. Look, one of them is called as a CPAP machine. CPAP stands for Continuous Positive Airway Pressure. And the other one is called as a MAD, Mandibular Advancement Device. Look, both of these devices will help cure your snoring problem. Both of the devices will help you to sleep better and breathe better while you sleep. Yes, so what is the difference between these two? Look, the CPAP machine you can buy from any pharmaceutical shop, but they are going to sell you only when it is prescribed by your doctor. And whereas the mandibular advancement device, that is called as MAD, you have to get it done from your dentist. Trust me, it's a painless procedure, because usually when we think of a dentist, we think of a pain, right? Yeah. So, in order to get the MAD done, you have to visit your dentist. Your impression will be taken, the impression of your upper and the lower jaw will be taken, and the device will be made and it will be given to you. And you have to wear it the entire night. It basically looks like a mouth guard, right? So what is the difference between these two appliances? These two appliances work different in a way, like the CPAP machine pushes air down to your throat and keep your airway open. Whereas the MAD, it prevents the tongue from blocking your airway. It too helps to keep the airway open and helps you to breathe better. Okay, but there is a problem. Although both of them works effectively in the people having snoring problem, but the studies have shown that people usually they stop wearing the CPAP machine after a certain period of time. Why? Because they find it difficult to wear it, because it all consists of masks and tubes. Whereas people find it comparatively easier to wear MAD, that is a mandibular advancement device. Okay. And moreover, the mandibular advancement device, it is easy to carry. It does not require electricity to operate. It is easy to clean as well. Other than this machine and the dental appliance, you have to bring changes in your lifestyle as well. Number one, you will have to reduce your weight, especially the fat around your face, neck, and the belly. Number second, include breathing exercises, that is pranayam, in your daily routine. These exercises will help you to sleep better, will help you to sleep peacefully, will help you to breathe better while you sleep. Yes. Number third, include vitamin B1, that is thiamine, in your diet. The sources of thiamine are eggs, chicken, fish, sunflower seeds, green peas, lentils, and cereals. There are other sources of vitamin B1 as well. Okay, now, studies have proven, research has shown that sleep apnea or snoring is linked to several diseases in the human body, like coronary artery disease, heart attack, stroke, behavioral problems, and diabetes. And there are several other problems as well that can happen in your body because of not being able to get sufficient sleep as well. So please, I request to all to treat this condition before this condition kills you. And please do not forget to like and subscribe my channel if you wish to receive such more information on health and nutrition. Thank you so much. Goodbye.